Finishing up Chapter 2, Objective 7, we're going to interpret the meaning of abbreviations related to body structure and oncology. Now, there is a table of the common abbreviations for this chapter. Again, in the real world, you cannot just use any abbreviation that you want. Your facility will have an approved list of abbreviations that can only be used. Again, you cannot make up your own. So the ones in the textbook are the common abbreviations that most facilities use. So here they're wanting you to identify the abbreviation for this type of cancer treatment. This is a chemotherapy treatment, so the abbreviation would be chemo, all lowercase. Now they want you to identify the abbreviation for radiation therapy. So if you look at your abbreviation table, it should be XRT, all capital letters. Now they're wanting you to match the definition with the abbreviation. So a cancerous tumor would be a carcinoma, abbreviated CA, both capital letters. A leukocyte is a white blood cell, so its abbreviation would be WBC, all caps. Identification of a disease is a diagnosis, capital D, lowercase x. They want the plural form of the term that means beyond control, which is metastases, which is METS, M-E-T-S, all caps. The prediction of a possible outcome of a disease is the prognosis, capital P, lowercase x. And then a erythrocyte is a red blood cell, or RBC, all caps. Lastly, Objective 8, we're going to apply medical language in clinical context. So this is the same scenario that is in your textbook. They want you to read this out loud in order for you to be able to pronounce the terms better. So let's just read it together. A 54-year-old woman presented to the office with a 3-week history of bloody diarrhea. She had been diagnosed with ulcerative colitis at age 25 years. She was referred for a colonoscopy. The examination revealed a suspicious lesion in the transverse colon. A biopsy was performed and a cytology specimen was obtained. The pathologist made a diagnosis of carcinoma of the colon. Advanced dysplasia and inflammation existed in the specimen. The patient underwent surgery and was found to have no evidence of metastasis. Her entire colon was removed because of a high risk for developing a malignant lesion in the remaining colon. She made an uneventful recovery and was referred to an oncologist for consideration for chemotherapy. Her prognosis is generally positive. Radiation therapy or biological therapy were not indicated in this case. So hopefully you were able to pronounce those terms correctly. And now they want you to answer these questions pertaining to that scenario, whether they're true or false. So let's do these. So number 1, the cancer has spread from the colon to other surrounding organs. Hopefully, again, just go back to the slide or just read it from your textbook. It says there was no evidence of metastasis. Again, metastasis means to spread, so there's no indication or no evidence of metastasis, so no, number 1 would be false. It has not spread. Number 2, the specimen is described as having abnormal development. It states advanced dysplasia and inflammation. So dysplasia is difficult abnormal development. So that is true. Number 3, the patient's prognosis is carcinoma of the colon. Well, no, the prognosis is the outcome. It should be the diagnosis would be carcinoma of the colon. So that is false. Number 4, the patient's colon was removed to avoid development of a malignant lesion in the remaining colon. That was true. It stated her entire colon was removed because of a high risk of developing a malignant lesion in the remaining colon. So 4 is true. And number 5, the patient was referred to a pathologist for consideration of treatment for the cancer with drugs. Well, no, it would be a oncologist is the doctor who treats cancers with drugs. So that should be an oncologist, not a pathologist. So here they're just showing you a picture of metastasis. Again, metastasis means to spread. So here we have just a picture. Again, this should be in your book someplace. I apologize for not giving page numbers. But basically, beyond control, the medical term would be metastasis. That's the breakdown of it right there. And so here they're just showing you the word metastasis. Meta means after, beyond, change, control. Stasis is control, stop, or standing. So if you're just looking at the word metastasis, that's singular. Metastases is plural. If they use the term metastatic, that's actually an adjective. And if they use the term metastasize, that is a verb. And then you have the abbreviations. Just MET is metastasis. METS is metastases, so that's the plural form. And then again, here's just a little paragraph about abbreviations. Again, we use abbreviations all the time, such as LOL for laugh out loud and other things, when we're texting and doing social media, things like that. But again, in healthcare settings, abbreviations can save you a lot of time, but they have to be accurate, meaning letters have to be capitalized when they should be capitalized, they should be lowercase when they should be lowercase, and so forth. Be careful when you're abbreviating because, again, patients and their families have the right to read the medical record when they have the proper authorization, of course. So when they're looking at these terms, they might not understand what you're actually trying to say. So if the patient has shortness of breath and you abbreviate it as SOB, and the patient is reading it, they might mean son of a blank. So just be careful with that. And then again, like I stated before, employees cannot make up their own abbreviations. You have to use only the abbreviations that are approved by your healthcare facility. And then one last slide, when negative is a good thing. A negative test result means that the substance or condition the test was performed to find or rule out is either not present or present in a normal quantity. Some diagnostic tests would yield a false negative or a false positive. So a false negative is the test result appears normal, but the condition or substance does exist. A false positive is when the test results incorrectly appear abnormal, such as a false alarm. And that should be the end of the slides for Chapter 2. If you have any questions, don't hesitate to let me know. Now you can go to eCampus and complete the assignments.